0.6%. Summer activities are in full swing for many, and so are injuries. But does that mean that emergency rooms are seeing more traffic? Joining us to talk about that is Dr. Thomas Nowicki, who works in the emergency medicine at Hartford Hospital. Doctor, welcome. Thanks for being with us.
Thank you for having me.
So many patients are fearful going into the hospital. They're worried about getting COVID. What are you seeing now in terms of volume? Are patients coming back?
Yeah, we are seeing an increase, but it's still less than expected. Typically, we're seeing in the order of about 80% of the volume we may have seen over this part of the season normally. And as an emergency physician, I'm concerned that there are folks out there with emergencies that need care and may not be seeking that care.
What about summer injuries? Broken bones, things that you would typically see in the summer. Are you seeing a downward trend in those too?
Yeah, visits across the spectrum, including things that I wouldn't have expected, such as stroke and heart attack. The numbers all seem to be down, and I know those things are still happening. So we want to make sure that the community knows that it's safe to come to the emergency department and they should seek care for those things.
All right, let's talk about that safety some more. What measures are in place to keep patients separated from possible COVID-positive patients?
Yeah, there are a lot of measures in place, countless measures really. Some of them are as simple as the things you're all doing, like wearing masks and social distancing. But the management of patients and flow from the point of entry into the emergency department, we're very cautious to try to maintain safety for you, for the community, our patients, but also for our staff. So we'll separate those patients by risk stratification.
Interesting. All right, you've also been involved in Hartford Healthcare's testing program. It ramped up and now it's huge. You just surpassed nearly 130,000 COVID-19 tests. How important is testing?
That's right. We're very pleased to have been able to provide that service for the community. It's vital for us to track the progression of disease and know where those hot spots are so that we can be proactive.
All right, and Doctor, final question. You guys, we had our wave here in Connecticut in April, and you guys all work so hard around the clock. Are people able to take any downtime and take some time off to enjoy themselves?
Yeah, I'm starting to see that where I think people had worked incredibly hard in the healthcare industry, and we're thankful to the community, for the things I mentioned, wearing masks and social distancing. I think our state's done an amazing job, and it has finally, I think, peaked for us where we can take a quick breather. We still want to be serious about this and provide good care and be safe, but I think we're just starting to get a break here.
Well, that's so great to hear. Thank you to all the healthcare heroes that brought us through this. I know you all worked so hard. Dr. Nowicki, thank you for joining us today. We appreciate it.
You're welcome. Have a good day.